Hi everyone, it's Dr. Dave and I am coming to you to talk about something that affects almost every other American in this country, and that's high blood pressure or hypertension. What is the definition of high blood pressure? High blood pressure is a reading of greater than 130, the top number, systolic number, over 80, 130 over 80. And again, every other American, almost 50% of Americans have high blood pressure. That is a tremendous amount of people. So there was a study that came out recently that was fascinating. And what it showed us was almost 1 in 5 people with high blood pressure, about 20%, were taking other medicines that could make their condition, their high blood pressure, worse. That's right. They were taking medicines unknowingly that could make their high blood pressure worse. So the message of that study is, if you're taking multiple medicines other than for your high blood pressure, you should definitely speak with your doctor and just make sure that you are not making or counteracting the blood pressure medicines, or you're not making your blood pressure worse. So just some other tips I want to give everybody in terms of trying to lower their blood pressure without adding additional medicines. So first tip is exercise. 30 minutes of exercise a day has been shown to lower the top number, systolic blood pressure, between 5 and 8 points. That's amazing because that's as effective as many medicines we use to treat high blood pressure. Next, weight loss. For every 2 pounds that we lose, you lower your blood pressure by 1 point. Sodium or salt. Sodium is in our food. And unfortunately, it's a real driver for some people. Not everybody. Some people are considered salt sensitive. So 2,300 milligrams, or about a teaspoon of salt or less, is recommended in patients who have high blood pressure. And actually, the American Heart Association probably goes lower than that, less than 1,500 milligrams. And if you can keep your sodium intake to less than 2,300 milligrams and lower, you can lower your blood pressure up to 5 points. That's right, 5 points. Finally, common medicines. Medicines we may be taking every day we don't even realize could be increasing our blood pressure. Examples are NSAIDs, or non-steroidal anti-inflammatories, such as naproxen or Aleve, ibuprofen, and Advil. So if you're taking over-the-counter pain medicines, be mindful that they may increase your blood pressure. Antidepressants, Prozac, Lexapro, SSRIs, and other antidepressants can contribute to high blood pressure. But please remember, do not stop your antidepressants just because you're watching this video. You must speak with your doctor first and consider adjusting medicines accordingly. Nasal decongestants. This is common, and I pause for a second because every day I see a patient who is on a nasal decongestant, and interestingly, their blood pressure tends to trend upward. So medicines such as Sudafed and neosynephrine can increase your blood pressure. Oral contraceptives can increase your blood pressure. Caffeine, caffeinated products can increase your blood pressure. Stimulants such as Ritalin for ADHD can contribute to high blood pressure. So my point is, be mindful, have a discussion with your doctor, and please don't stop any of the medicines I mentioned just because of this video, but rather have a discussion with your doctor or healthcare provider. Okay, everybody, I hope that helps. Until next time, this is Dr. Dave.